There are a lot of different lasers we offer here in the clinic, and I wanted to go through some of our most popular ones. Number one is the Moxi. I absolutely love the Moxi. It's a 1927 nanometer wavelength laser that can be used on all skin types, young or old, and it's a beautiful way to help rejuvenate the skin. It promotes collagen and elastin production. It also helps refine pores so that they look less apparent. It also helps with textural changes within the skin. And what I love most about it is that it's safe to use on melasma patients. So a wonderful treatment to help diminish the appearance of hyperpigmentation. So what does it do? It creates these micro columns of injury that then trigger your body to help create and promote collagen and elastin production. So after 3 to 7 days of a little bit of downtime where you look like you almost have more pores during that time, your skin is literally glowing and oozing with suppleness and refinement. So a lovely treatment that can be done, as I mentioned, once a month on all skin types. And you can do it either as a course of treatments, 3 treatments 1 month apart, or you can spread them around. I love using the Moxi to treat my melasma, and I generally do it sporadically throughout the year. So often I have one in September after the summer in conjunction with topical skincare, then before the winter holidays, and again in very early spring so that I can have clear skin as I enter the summer months. Prior to treatment, patients come about a half an hour earlier to have a Vizia scan done, and that really gives you a baseline of where you are on that day and how you do relative to other people. Then some numbing cream is applied anywhere between 20 and 30 minutes. Afterwards, the treatment is done. It's quite quick. Sometimes we do it in combination with BBL, which is broadband light, to add a little extra bolster to the procedure. And then afterwards, skin is pink, and you start to develop these little dots all over the face. Generally, the feeling of heat lasts for about 2 to 3 hours, as does the redness, and then it quickly wanes down. So most of this the following day can be covered by a tinted SPF or a tinted moisturizer. Afterwards, we ask that you use lots of hydration on the skin. Some examples of a hydration is something like an Aquaphor or anything that's deeply hydrating to the skin, as well as an abundance of SPF. Slowly, the little dots that form on the face fall off between 3 and 7 days later, depending on the strength and the amount of treatment done. And then afterwards, you really do have beautiful, clear skin. Number 2, ProFractional laser. Another laser treatment that I absolutely love. This too creates microcolumns of injury and is a little bit deeper and stronger than, for instance, a Moxi laser. This is a great treatment to treat fine lines and wrinkles, as well as acne or other types of scarring. Basically what happens is that you come in, again, you have a Vizia scan to have a baseline with some numbing treatment. Sometimes we use just topical, and other times a local anesthetic can be used to help reduce pain during the procedure. The treatment is done, it's quite quick. It creates these microcolumns of injury, and then that triggers your body to create a cascade of events to fill in the areas that have been treated. And that helps improve the appearance of fine lines by increasing collagen production, and in a similar way for those who have acne scarring. I absolutely love this treatment as well for the right candidate, but it does have a little bit more downtime than, say, for instance, a Moxi treatment does. You will potentially have some bleeding and or scabbing associated with this, and you may have a heat sensation afterwards for 2 or 3 hours. The area will be red and, as I mentioned, could have some scabs between anywhere 3 to 10 days. Again, aftercare treatment is really important. Oftentimes I combine this with topical skincare, not only to help prevent pigmentation, but also to help hydrate the skin with something like Cicaplast or an Aquaphor in conjunction with high SPF is really critical, as well as potentially some prescription medication that I ask you to apply prior to that as well. This treatment is best done in the winter months when you have less exposure to the sunlight, because remember, sun is not your friend after you've had any sort of laser treatment for at least 1 month after having treatment. And also, just a reminder, it's best to have these treatments when you're not tan as well. Number 3, TRL. I love this treatment to have in our repertoire. It is a stronger laser, which means that it can treat at variable depths and degrees to treat deeper lines as well as deeper acne scars or any type of scarring. The treatment is a little bit more uncomfortable and requires local anesthetic in conjunction with topical anesthetic. Treatments are done generally 1 to 2 treatments, 1 to 2 months apart from one another, and are best done when you do not have sun exposure. Post-treatment, it's really important for you to follow the guidelines of hydration, SPF, and potential prescription medication that I've given you as well. This is a wonderful treatment for those that want a stronger and deeper rejuvenation of their skin, whether it's from scarring or those lines and wrinkles. Again, the downtime varies depending on the depth and penetration of the treatment done, but can vary anywhere between 1 week to 2 weeks, depending on that strength. Remember, you may have a little bit of crusting, redness, and swelling with this treatment, and it may not be acceptable for you to go out to, say, dinner during that period. So downtime is important to remember when you're considering this treatment. These are a few of my favorite treatments to tackle different issues within the office, going from light to strong. Aftercare is similar for all laser treatments, which means avoidance of sun for at least 1 month post-procedure, and the use of SPF diligently every single day with multiple applications. Hydration of the skin and pre and post treatments with topical prescription medications may also be necessary. And remember, if you suffer from cold sores or anything else, please do make sure you let your prescribing or treating doctor know.